A lot of people really lose it with the herpes outbreak. It seems to be something that people are much more traumatized by because it is permanent, because it's viral, than they would be by something like chlamydia, gonorrhea, trichomoniasis. For whatever reason, herpes seems to be very stigmatized.
Hey, I'm Jen, host of the Open Bedroom podcast, where you'll find topics of sex, dating, relationships, non-monogamy, and more. I'm glad you're here. Let's dive in. Welcome back to the Open Bedroom podcast. I have my friend Nurse Amber on. The other day, we had her and her husband over, and we were playing board games and having, just the regular conversation around STIs. And Amber exclaims, "Everyone has herpes." And I was like, that's what I'm going to call our episode when we get together and talk about all things STIs. So, Nurse Amber, what makes you qualified to have this conversation with us today? Tell us a little bit about you and your background.
I am a board certified women's health nurse practitioner, and I have worked in public health for over 11 years as a nurse practitioner. And I do a lot of STI testing and treatment in patients with vaginas and with penises. So I am not exclusive to women, but that is my board certification.
Fantastic. I should also warn you guys that my husband made us sangrias. So we're on our second sangria cup at this point. So the things might be really fun today. All right. So let's start out with the headline. When you exclaimed, "Everyone has herpes," I was like, what? What are you talking about? So, can you explain what you explained to us on board game night so that our listeners understand, what is going on?
So it's really interesting. That's a really common conversation I have probably 2 to 3 times daily, 5 days a week with patients. And I do a lot of STI testing in my practice currently. And patients frequently want testing for herpes, but they don't have symptoms. And I don't outright refuse the testing, but I do tell them it's of limited clinical utility because we know that probably 50% or more people have HSV type 1, which is the type that causes cold sores. And probably 12 to 50% of people have HSV-2. I think that used to really probably be a little bit more clinically significant than it is, because the last conference I went to, the person that was giving the seminar was like, herpes is herpes is herpes. If they know they have type 1, it can be sexually transmitted. We should consider they have herpes. And so, so many people have herpes, be it from sexual transmission or not. You can have herpes as a child because your parents had herpes, from cold sores. So you can actually transmit HSV-1 genitally, rectally. You can transmit HSV-2 genitally and rectally. So you can have either type of herpes in either location. So nothing really is genital or oral anymore.
Got it. Okay. So it doesn't mean every human is walking around with herpes, but the majority of people are. It's similar to the divorce rate. More than 50% of people will get
Greater than
divorced.
50%, and some quotes of upwards of 80% on HSV-1. So a remarkably high percentage of the population.
Amazing. Okay. I have heard people say, "I won't test for herpes unless there's an active outbreak," because there's something psychological that seems to flip a switch, and then all of a sudden people will start having, actual symptoms happen. Have you heard of this? And is this a myth, or tell me the truth?
I think anytime people think they might have been exposed to something, then they do tend to have a little bit of psychosomatic symptom where they're like, "Oh my God, I think I have burning, or I think I have a sore, or I have this itch." And truly that's what it is. Really the main thing, the reason why I really try hard to get people not to get herpes testing by serology or by a blood test is because it's an antibody test. And what that does is tell us you've been exposed. Now, if you have a high level of antibodies, you probably do have herpes. But if it's very low, it could be false positive from exposures, and you may not actually have symptoms. But yes, I do feel like because of that, I feel like I can induce a certain amount of paranoia, even after that explanation, because they'll come back negative on the test. But if you've never had an outbreak, you may not have a high level of antibodies. They can come back positive, but might actually not really have herpes. It might be a false positive from exposures. And so people are like, oh my God, I have herpes. Now what? Or, yay, I don't have herpes. And it's like, maybe, maybe not in both cases. So,
As a nurse, I'm sure that you walk a lot of people that do have an active and, an active, it's not called an infection, an active, what is it called?
an outbreak.
Outbreak. That you've, probably walked people through their first one, like what is happening or whatever, right? How would you coach someone to have a conversation with a future partner when you know for sure that you do?
Yeah, so that's common. A lot of people really kind of lose it with the herpes outbreak. It seems to be something that people are much more traumatized by, because it is permanent, because it's viral, than they would be by something like chlamydia, gonorrhea, trichomoniasis. For whatever reason, herpes seems to be very stigmatized.
Hmm.
But what I tell people is, hey, we're adults if we plan to be sexually active. This is just another part of the conversation. And, for some people, that's a deal breaker. Like, I'm not going to have a partner that's positive. But for most people, I feel like if you have like a rational conversation and say, hey, I've tested positive. I know I'm positive because I've had an outbreak.
Hmm.
Um, but I you could say, I don't have frequent symptoms, or if you have frequent symptoms, you can be on suppressive therapy, which reduces your risk by 50% of passing it on to your partner. And just in knowing like the most common time to actually pass on the virus to a partner is when you have an active outbreak. So avoid any kind of sexual contact during an actual active outbreak. But you can pass it on even during times when you do not have an outbreak. So it's just all a conversation piece on, hey, you may be at risk even if I'm not having an outbreak. We can reduce risk by using condoms, using dental dams, with oral intercourse. So it's all just another part of risk involved, but you can mitigate risks
Hmm.
to some extent.
Cool. Okay. So I want to move us from herpes into what are the most common STIs?
So I would say genitally, probably chlamydia, um, gonorrhea, trichomoniasis, those are going to be like your trilogy of most common ones that I see in clinic probably multiple times a week, if not daily. Um, chlamydia, probably the most common.
How does one know that they have an STI?
Well, 50% of the time, one does not know. And so, especially chlamydia, which seems to not cause a lot of symptoms for most people. If you are symptomatic and you're a person with a vagina, you oftentimes will have um, discharge, clearish, or just kind of profuse cloudy discharge. You might have bleeding after sex. You might have mid-cycle menstrual bleeding. You might have a heavier or more crampy period. You could have an odor. You could have just pelvic pain. So those can be somewhat common. In patients with penises, if they have symptoms, burning with urination, maybe a clear to cloudy discharge from the penis, pain with ejaculation, sometimes testicular pain. Those can be things, or low abdomen pain. So those are fairly common symptoms when people do have symptoms.
And what about trichomoniasis? How do you say it?
Trichomoniasis. So most people
Trichomoniasis.
I find don't know about trichomoniasis, but I think worldwide, if not the most common STI, it's definitely one of the most common. It's actually caused by a parasite. And so if you look at it under the microscope, so I will do a swab when I do an exam, I'll carry it to the microscope, I'll do a little, what we call a wet prep or a wet mount, and you'll see like these little amoeba looking creatures swimming around under the microscope, but they're just hanging out and they're in your vagina, or if you're a male, in your urethra and your bladder. And so, male patients, it's diagnosed by doing a urine sample all the time, pretty much. We don't do genital swabs of male patients anymore, but it causes kind of similar things. Burning with urination is a big one with trich. For people with vaginas, often it causes extreme inflammation and burning if they have symptoms. I mean, like you will see redness, swelling. You do a vaginal exam, the walls of the vagina are very, what we call friable. You touch it and they'll bleed. I mean, so they're very sensitive. It's very unpleasant for patients when they have symptoms. And then the vast majority of people don't. So they're just walking around with it.
I mean, so for any of these three that we just talked about, I know you can take medicine and it
Mhm.
goes away. Like it's not the end of the world.
Right.
If you don't know that you have it and you're walking around, obviously you're spreading it to other people if you're having sex. What else could happen to your body if you never got this thing cured and you're just walking around with it?
Yeah, so sometimes people will have spontaneous cure of STIs that are bacterial, and it can take months for spontaneous cure. And oftentimes it may not even be spontaneous. Sometimes people they'll take a Z-Pack because they have a sinus infection, or they take some amoxicillin because they have strep throat or whatever,
Mhm.
and it will knock out whatever that infection is. And unless they have expose themselves to that same partner that's positive again, then they're good, and they don't know about it. But for chlamydia, for gonorrhea, sometimes trich, although not as likely, in female patients, it can lead to PID or pelvic inflammatory disease, which can be very serious and life-threatening, where you actually will get severe inflammation, and infection that ascends up to the uterus and into the fallopian tubes, and you get pus and extreme infection like up in those areas. If that happens and it's treated, thankfully, like people remit and they usually feel better, but can have chronic pelvic pain or impaired fertility with it. If it's not caught and people have severe symptoms, you can die from pelvic inflammatory disease. That doesn't happen often anymore because there have been guidelines on screening women under 25 annually for STIs for years.
Mhm.
And I think we're just getting better in general about saying, hey, if you're in a higher risk group, you should screen more frequently than that. So,
How common are these STIs? Like if I was to have sex 100 times, like what is my percent chance that I would get one of these? Is it pretty high?
I mean, I would say it can be, is what I would say. I don't specifically know all the statistics. I did, however, just read an article by the National Institutes of Health that said that for gonorrhea, with one episode of vaginal insertive sex, the risk for acquiring gonorrhea was 20%.
Mm.
And with each repetitive act, it increased to about 60 to 90%. And
Wow.
so it's actually, and gonorrhea is a good example of an STI that's very tenacious. And there's a lot of antibacterial resistance with gonorrhea. So what we used to treat it for in the past, it's now kind of useless, and we've had to move on to other drugs.
Okay. Talk to me about incubation periods. Like how
So,
soon are you like something's funky?
right.
If you
Well, that's
even
the
do, right?
right. That's the interesting thing is that, most people are like, well, I have no symptoms and I would know if I did. And you're like, not really. At least 50% of the time, you probably wouldn't. But in my practice, we tell people that they should wait 1 to 2 weeks after a new exposure if they haven't had other partners in the meantime, like previous to this partner. 1 to 2 weeks after a new exposure before your genital STI testing is really accurate. So that's chlamydia, gonorrhea, trichomoniasis. I mean, you have to realize there's a bell curve on things. Sometimes you'll pick it up way early, but you should pick everything up by 2 weeks post-exposure. And that's for genital. But for things like HIV and syphilis and some of the hepatitises, it can be 1 to 3 months. So if you've had a new exposure of less than a month ago, we're going to get good results on your genital testing, but maybe not your serology.
Okay. So just in the same spirit of how do we share this with partners, that we did with the herpes conversation, how does one tell your people or your person, I have chlamydia or gonorrhea or whatever?
Well, I think again, we're in an interesting time period in which people are a little bit more open. Things are a little bit less stigmatized. I mean, I feel like when I was in high school, and I mean, for reference, I'm 43. When I was in high school, it's like, oh, she has the whatever, she's a slut, stay away from her, that kind of deal. But I feel like now, people are waiting longer before entering monogamous relationships. People are having non-monogamous relationships that is socially acceptable. And so I think if you're a sexually active adult, you just say to your partner, hey, I had my annual exam, my routine STI testing, whatever. I came back positive for XYZ, and now we need to treat you also. And we have to avoid having any kind of sexual contact, oral, vaginal, anal, for the next week. So, I mean, unless it's herpes, and then that's a whole other thing, like we talked about. But yeah.
Okay, fantastic. Talk to me about testing frequency. So I just recorded a podcast episode and I kept trying to get him to tell me how often should I test. You
Right.
know that this podcast is called The Open Bedroom. It's typically geared towards people in a non-monogamous relationship. So maybe, talk out of if, one side, if you're monogamous, maybe you don't need any testing. I don't know. I'd love for you to talk
Sure.
about that. And then if you're in a pretty active non-monogamous relationship with your primary partner, or whatever partner, like how often should we get tested? Because I believe that listeners want to do the right thing. We want to take care of our partners. We want to be healthy. We want to not be spreading STIs everywhere. So what's the best practice?
So I feel like if you rarely have a new partner, maybe every 6 to 12 months, maybe you date someone, you're serial monogamist, but you will have a partner change once or twice a year. Every 6 to 12 months is really fine. When you're entering in a new relationship, I would do testing before starting a sexual relationship with that partner. If you're very active, you want to think about incubation windows on things and just think, well, we're going to get all the good information if it's been 3 months post this new exposure. But if you're, if you're super, super active, you probably just want to schedule that every 2 to 3 months. And, you're going to catch it before spreading it elsewhere. If that's the case, if you just routinely do it.
This is excellent because it leads me to my question about telehealth. If you're in the, let's say the swinger camp and you're like having a whole lot of fun every weekend with a bunch of different people, getting into a place to do an STI test every 2 months could be a lot, especially if you
Right.
travel. So I'm
Sure.
curious, like, how do you feel about telehealth and about our different options today to get seen, because I know some of these things you probably need to be swabbed, you need to have blood draws. Like, I don't know if you can do all that through telehealth or not.
It really kind of depends on who your telehealth provider uses as a lab provider.
Mhm.
So in my current position, we use Quest, and Quest will do urine testing for gonorrhea, chlamydia, trich. Mycoplasma genitalium, um, things of that nature that are urogenital based. Um, they will not generally do oral swab or rectal swab, even with patient self-collecting. They will not do it, it seems. Although I have had a few patients that are like, oh, I went, they took it from me, but by and large. Um, blood testing, they'll do all the testing. But I do see people that are asymptomatic on telehealth for STI testing. And I'll just put the orders in. They go to their quest wherever they are in the United States. So that's great because there's usually a quest somewhere in a state. And they go in, you give them your legal name, your date of birth, they pull you up, you get the testing. Now, if someone has symptoms, I don't like to see that patient telehealth. They really need to be seen in person. And that really kind of goes, I mean, it goes really for everyone, but it's really more so a thing with people that have a vagina because vaginal itching, burning, discharge, pelvic pain, that can be signs of chlamydia, gonorrhea, trich, yeast, BV, mycoplasma. I mean, like it could be any of the things. With people with penises, I mean, the window narrows significantly. They typically are not symptomatic. With yeast, a few situations where they are. BV, they don't have vaginas. They don't have symptoms of BV. So, like, your window of what they can have is very limited by comparison.
Okay. All right. So one of the things I remember you mentioning over board game night was DoxyPEP, and I had never heard of this ever in my entire life. And I can't believe that we've been in an open relationship for 4 years and we had never heard of this. And then you also mentioned something called PrEP. Can you just tell us what are these things used for?
Yeah, so I think probably more people are a bit familiar with PrEP than they are DoxyPEP. But PrEP is pre-exposure prophylaxis for HIV. It's medicine you take either on a daily basis or in people with penises, 211 PrEP is used, which is PrEP on demand, taken the day of sex and then the day after and the day after that. Or you can be on injectable PrEP. And there's a PrEP that's a 2-month shot now and a PrEP that's a 6-month shot now. So any one of those things is great. Getting PrEP is awesome if you're frequently with new partners, or you have certain other risk factors, like you have a known partner or a prospective partner that has HIV. You use IV drugs or a partner uses IV drugs, or you've ever had to or currently exchange sex for drugs or money or personal needs. Anonymous partners, people with any kind of risk factor like that, it's really beneficial to get on PrEP. It reduces your risk of acquiring HIV by over 90%. It's high 90s.
Wow.
Yeah. And DoxyPEP, I tell people it's kind of like Plan B, but for bacterial STIs. So it reduces your risk of chlamydia and syphilis by about 70%. It only reduces your risk of gonorrhea by 40%. Again, it's very tenacious. So, with DoxyPEP, you take 2 capsules at the time of unprotected sex. You only take 1 dose within 24 hours. So that means even if you have multiple sexual partners, multiple episodes of sex in 24 hours, you're still only going to take that 1 dose. And you can take it up to 72 hours after unprotected sex, but it's most effective when you take it in that first 24-hour period.
How does one acquire DoxyPEP? It feels like anyone that's sexually active, quite a bit. Like this is a tool in your toolbox that you should definitely take with you when
Yeah,
you're, going to a party, doing things with multiple people, having
absolutely.
having a new partner.
Yeah, I think it is probably less well known, especially in private practice providers.
Okay.
I think if people go to their gynecologist, if people go to their PCP, they're going to say something about it. They're going to be like, "What? I've never done that before," or maybe I've heard of it, but I've never prescribed it, or I'm not comfortable with that. That kind of thing. Planned Parenthood is a good place to acquire DoxyPEP.
Hmm.
Um, if you in your town have someplace that purports itself to be an LGBTQ health center, also a great place for that.
Okay.
And so typically those really cater to people who are not specifically in the, heteronormative, monogamous norm. And so it's really much easier to get those sorts of things. And also you don't get like the third degree about it. They're like, oh, great. You want to protect yourself and your partners? Woo!
Yeah.
So
Would the state health department have something like this
no,
or
they
no?
don't.
Okay.
They don't.
Okay.
Yeah. Well, it depends. I won't say every state doesn't. Um, and I will say there are probably regions that do
Hmm.
within certain states, but not every region and every state has it. And you have to realize like things are not the same across the board. Every state is allowed to allocate its funds in different ways. And so that's why.
Cool. I was just curious. I remember looking at ours and I was like, dang, you can get like 10 different kinds of IUDs and like all kinds of like implants and stuff for pregnancy prevention. And I thought that was amazing because back in the day when I went and I was like 19 or 20, it was like, here's the pill. Have
You
fun with
can have a
this.
pill or
Don't
Depo,
forget.
or you can have Paragard, but you haven't had a baby, so don't do that. Like, and that's all out the window now.
Yeah, I
So.
love that. I love that.
Mhm.
Okay, syphilis isn't dead.
It is
Tell me,
not
tell me
dead.
about this.
So, I say that because when I first was a baby nurse practitioner, I graduated and got my first job. I thought, oh, that was eradicated in the 1950s. And then I found out, in fact, it's actually quite prevalent in the United States, and especially in the South, it's very prevalent. Um, you should be screening for it with your regular STI tests. HIV and syphilis, always an irregular STI test. It is also a thing that is sneaky. It is coined the Great Pretender
Okay.
because it can really act like so many other things, or people think they have other things, but it's really syphilis. And so, for example, it causes in primary syphilis a sore that is not painful, but it looks really nasty. And people are like, oh man, what is that? And then because it doesn't have pain, because they're not having really much noticeable other symptom, they're like, and then it goes away usually within weeks. They're like, oh, well, that was weird. And then they don't think anything about it. And that was their primary syphilis. And then secondarily, you get a body-wide rash or a rash on your hands and feet, and people are like, huh, I must be allergic to something. And so they don't do anything about that.
Hmm.
And yeah. So, I mean, I feel like there was really a rise in syphilis in the United States within the last few years. We are now seeing it decrease for the first time since COVID, thankfully. Uh, in my profession, I feel like COVID played a big part in people having an increased rate of STIs
Huh.
because we were supposed to shelter in place, but
Uh-huh.
that was really boring, and people were sheltering in place with other people, and that that caused an increase in a lot of STIs.
Nice. Okay.
Right.
So syphilis isn't dead. What about HIV, which I remember hearing about so much in like the 80s and
Right.
90s. It was like, if you have sex, you're gonna get
You're
AIDS
gonna, yeah,
and
it's like,
die.
yeah, it's just like Mean Girls. If you have
Hmm.
sex, you will get pregnant and you will die.
Hmm.
I feel like when I was a teen, also that was a big thing. Like, oh my God, what if I get AIDS? What if I get HIV? And
Hmm.
the thing is, you don't see AIDS anymore. You rarely ever see AIDS
Hmm.
because we catch it at HIV. And so people will often, go for routine testing, and that's how they find it, or they may be in the hospital with something unexplained. They'll test and they'll find it. But In the last, so I've been a provider for over 11 years now. I've been a provider for almost 11 and a half years, and I've only diagnosed one case of HIV ever, which is great. I feel like it's
Because you would
definitely,
say that's thousands and thousands of
oh
patients,
yeah,
right? Okay.
absolutely. Now, you have to also realize that I don't always see all the results that come back. I have, in working in a health department, you have a team that manages those results. And so like they take care of that, and you maybe don't hear about it. Oftentimes you do in a small practice though, but
Okay.
you may not always. So I would say still yet, I know I've only seen one person with HIV that transferred to me, and I have only diagnosed one person. So you are way more likely to get a bacterial STI or herpes than you are
Hmm.
to get HIV, but it is lifelong. It's not going away, and it leads to other problems. And so finding out you have it sooner rather than later is a way better thing.
Hmm.
And it's incredibly treatable now. It's just like a chronic health condition. You
Mm.
put it on the same level as you put diabetes, basically. Like you take your um, ART every day, you have a partner take their PrEP every day, and your risk of transmission is very low. In fact, it used to be that in women who were seeking pregnancy, they needed to be on ART and have a low viral load. But the risk of vertical transmission, I think, was less than 1% if you
Wow.
have met those conditions. So, to put it in perspective, you're much more likely to vertically transmit Hep C to your baby than you are HIV. So, Hep C is actually way more contagious than HIV is.
Hmm.
So, mhm.
Amazing. I didn't know any of
Yeah.
that. That's so interesting. Well, as you've been talking, I've been sitting here thinking about like my yearly gynecologist appointment that I have. And I have to request blood work every
Hmm.
time. It is not normal. They do the swab.
Right.
They don't even have me pee in the cup.
Right.
I am super open and honest with my gynecologist, so she knows I'm in an open relationship. It's in my chart. They say it every time. Oh, that's right, you're in an open relationship. Do you want the blood stuff? Like, that's what they ask me. Do you want the blood draw stuff? And I'm like, yes, every
Hmm.
time, right? So at least once a year, that's happening. Well, I'm curious, all of these things we've been talking about, like, obviously, well, let's just say if you're a woman, if you're a person with a vagina and you're going to your gynecologist and they're just doing a swab, they're checking your vagina and they're like boop 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 done, like are they going to catch all of this? Because they're not having you pee in a cup. They may be checking the swab, but like what happens
Right.
there?
So if you're under 25 annually, they screen you for gonorrhea and chlamydia. So they should catch that
But I'm
for
not
sure.
25, I'm 42.
You're not right. So
And I'm
if
sure
you
I'm
do,
higher risk. Like it's
sure,
on the chart. This woman's having
right.
sex with more than one person.
Yeah, I mean, if you are getting a pap smear,
Hmm.
sometimes even if you don't include that testing with the pap, even if you don't request that, it might pick it up. It might pick up trick because they could see the little dead amoeba looking things floating around in your sample, like on under their microscope. But even so, if they're not specifically looking for it, they oftentimes will not diagnose it off of your pap smear.
Hmm.
If you're not asking for those tests, you're not getting those tests. And by
Okay.
the way, every time you get up in the stirrups, you're not having a pap smear. And that's what a lot of people think. Oh, I had my pap last year. No, you didn't.
What do
You
you mean?
had, yeah. So we now recommend a cervical cancer screening every 5 years to women over 30 if you're looking at American College of Obstetricians and Gynecologists guidelines. Where I work, we use American Cancer Society. We only recommend cervical cancer screening every 5 years after 25 because we do primary HPV testing. If you're under 25, or sorry, under 30 and you're doing ACOG guidelines, it's only cytology. So only looking at the cells, and that's every 3 years. So every
What?
3 to 5 years is when you're actually getting a cervical cancer screening. You're not getting a cervical cancer screening every single time you lay on the table and get the stirrups. Unless
What?
you have unless you have a late adopter to as your provider to recommendations.
What the hell are they doing up in me then?
They're looking at your cervix and they're feeling the size and shape of your uterus and feeling if they can feel any masses around your ovaries.
That's it?
That's it.
Okay, so school us. What should we be asking our providers for?
So I would say, if you've had new sexual partners since your last STI testing, you should definitely be asking for chlamydia, gonorrhea, trichomoniasis on your pelvic exam. And then you should be asking at a minimum for HIV and syphilis in your blood testing. If you have never been tested for hepatitis C in your lifetime, you should be tested at least once in your lifetime for hep C. If you haven't been vaccinated for hepatitis B or you're immune compromised, you have new risk factors, you should be testing for hep B, probably at least once in your lifetime, and possibly more if you have lots of other risk factors. But for the most part, once in your lifetime for the hepatitis is probably good. When I say other risk factors, I mean, so especially for hep C, if you have an occupational finger stick or needle stick, if you have a blood transfusion that's unscreened, which doesn't really happen in the US anymore. But say you go to a third world country and you had to get some blood, like weird things happen. You want to get screened for HIV. You want to get screened for hep C. You want to get screened for hep B. If you use IV drugs or have a new partner that uses IV drugs, that's a reason to get screened for hep C. If you exchange sex for drugs, money, personal needs, you want to get screened for hep C. So typically hepatitis C is more so in the blood-borne transmission, but can be sexual, but lower extent. And that's why we don't recommend it like regularly, because you will see even long-term partners where one partner that has hep C, the other partner doesn't have vertical transmission of that virus. So it's not as much unless you have blood present and body fluids.
Talk to me about triple testing. This is a perfect place to input that. Like, what the hell is it? Do I need to be asking my provider for it? And is this something that you ask for every time you have an STI test?
So yes is the answer. So the National Institutes of Health feel like you should get triple tested because apparently there's a large percentage of STIs that could be missed rectally or orally if you're not testing those sites as well as genitally. If you follow some CDC recommendations, you might only be testing genitally, either with a swab or with a urine sample, and you're going to miss out. And so, especially in people with penises who have sex with people with penises, gonorrhea is very common rectally and orally, and may not even be present in urine samples for whatever reason. It is less risk. Chlamydia is very low percentage of transmission into an oral sample. You don't see that super often. I see it probably once or twice a month. Gonorrhea, though, more frequently, definitely more so with a rectal swab as well. Rectally seems to be, just a good mode of transmission for it. Although with gonorrhea, pretty much anything. So, but yeah, I would recommend a triple test. Oral
So
swab.
is this only a triple test if you have a penis in your mouth or a penis in your butt? Or
No.
give me some reasons, because some people may be thinking, well, I use condoms.
Sure.
But do you use condoms when you give oral? Like, that's a big question.
So I see a lot of patients that are ethically non-monogamous, some that are non-ethically non-monogamous, but, and even just people that are, dating people and then are serially monogamous, shall we say. People don't think about the fact that oral sex can be a mode of transmission. Women often, I need to use condoms because I need to prevent pregnancy. or I don't want a genital UTI, but they don't think about using a condom on their male partner when they're performing oral sex. The same thing really goes if you're anyone else who's performing oral sex on someone with a vagina. I don't even know that I've seen a dental dam in a store ever,
No.
but um, you can go on Amazon and you can order a dental dam, and it's basically a sheet of latex or another barrier, and you just put it over the vulva or the anus if you're performing analingus, and it helps prevent you from getting those STIs in your throat. So, yes, you can get them. You can get them orally. You can get them rectally. But I often find that a lot of women are like, oh, I use this for birth control, but I don't do this. And so, like, oh, we've missed this, and they may have a primary partner that they don't use condoms with. And so they do both things with that partner with no condoms. They may have a secondary or a third partner or whatever where they use condoms because they don't want fluid exchange. They don't use condoms with oral sex. And so
They're all
we're not
passing
going
it
to
along
see
to each
it.
other.
Yeah, we're not going to see it on a genital sample, maybe. We're only going to see it on that oral or rectal sample. And so it's really important, especially if you have multiple partners, to do it. But there can be other cases, even when you don't, where you will see it rectally when you don't have anal sex. So the genital bacteria can migrate into the rectum, and it will colonize there as well. And so, or vice versa,
Would you
rectal.
know if it's colonizing in your rectum? Like, would it feel funny?
If you have symptoms, maybe. I find that people with rectal gonorrhea or chlamydia don't often have symptoms, but if they do, they will have like a mucoid type discharge from their anus.
Okay. All right.
Yeah,
I have some myth busting I want you to do.
right on.
So, husband and wife or partner, one person goes and gets tested, so it means the other one is basically getting tested too, right?
Maybe, probably not
If I
though.
have
I
something,
mean,
does my husband also have it?
it depends on if you have all the types of sex with that partner without condoms all the time and that kind of thing. And
Hmm.
also, sometimes, and without explanation, like you can read lots of journal articles about this, how inexplicably some people just don't get certain things in certain places, but it's way more common. Like they may have an oropharyngeal swab for gonorrhea that's positive, but their genital or rectal sample is not, even though they have all those types of sex in all those places. So, is it true? Well, maybe, maybe not.
Because on this last STI podcast that I recorded, he was like, Jen, that is not, you can't know. You can't go have, because Scott goes to the VA and he gets free STI testing. And so I'm always like, you just go get tested for us. And I was like, by proxy, I'm being tested because if I had anything, he would have it. And I remember he was like, no, that's not how this works. Like sometimes you can pass it to your partner. Sometimes their body doesn't have it. Sometimes they have something that you don't have. And now to your point, with the trifecta, you can have something in one orifice and not another orifice. So what I'm learning is like this is all very unique to your own body chemistry and what it's decided to keep and not keep and where to keep it. And that we like the moral of the story is like go get your shit checked out in like literally all three places.
A whole new world. Yeah.
Okay, I want to talk about female health that's not sex related. I mean, it probably is in some ways, but and maybe this is just because I currently feel like I have another UTI, but I'm like, what the fuck is happening? And I'm perimenopausal, so all my friends have UTIs all the time too. Is it common for for people with vaginas to have frequent UTIs and BV and yeast infections? Like, what is happening? How do we just keep ourselves healthy? Why does this seem to always be a thing? Please tell me all the
Right.
things.
So I will say, like, you're always going to have some patient that is your poster child for like recurrent UTI, recurrent BV, or recurrent yeast, but this is not normal.
Okay.
So we should not normalize those things as being just a part of life because they shouldn't be. So with BV, with yeast, even UTI, a lot of times it is mediated by lifestyle. And I don't just mean like, oh, you're having sex without condoms. Like, sure, that's an easy thing that you can change that's modifiable, but it may help, but it's not the whole answer. So I tell patients all the time two things about vaginal health. One, your vagina is like a self-cleaning oven. It doesn't need you to do anything for it. And two, if you wouldn't put it in your eye, don't put it in your vagina. So, and what I mean by that, obviously, people aren't putting penises in their eyes. I don't know. I'm not going to kink shame anyone. It could be a thing. But, the tissue that lines your eye or your mouth is the same tissue that lines your vagina. And if you think about it that way, you're not going to dump soap in your eye. You're not going to drink soap, right? So you definitely don't want to put those things in your vagina or on your vulva. And when you think about putting soap in your eye, it fucking burns, right?
Right.
Same thing happens with your vagina.
Oh.
And so, yeah. So,
and can we get specific, like you and I were about doing downstairs in the kitchen over sangria?
So,
like my lady bits, like
yes.
the inner of your lips, like the outer of your vagina, like do not put soap there.
Correct.
Like, how do you clean that?
Just plain water, just cool water or water in the shower. And then after you get done, pat dry. You don't want to wash with a loofah or a rag. That tissue doesn't need lots of friction to it in that circumstance anyway, right?
Okay.
But it doesn't need that. And you don't want to use soaps because soaps are surfactants. So what they do is they like make it easier for particles to slide off. And so when you're using a surfactant, you're potentially removing beneficial bacteria that keep that bacterial level in check. And so you're not going to have, overly high levels of bacteria that cause BV or yeasts that cause yeast infection. The other thing people do all the time now is they wear workout clothes all the time. People wear synthetic fabrics all the time.
Mm-hmm.
People are in leggings, they're in thongs, and like those trap and hold heat and moisture. And so the vagina doesn't like those things. And thongs, like, it goes up your butt. And so you bend over, it slides up, you stand up, it goes back. So you're transmitting. Yeah.
No!
Yeah.
Oh my God.
Yeah. So, I mean, you're transmitting more easily some rectal bacterias that way.
Oh my God. So I'm hearing just like don't wear panties and maybe don't wear your leggings all day long.
Cotton, change out of things that are wet or sweaty quickly,
Okay.
after you have sex, like go to the bathroom, flush bacteria out of your urethra.
Okay.
And then, wipe with a moist soft cloth or just rinse with a bidet or something like that and pat dry gently. Like you don't need fancy soaps or anything. If it says soaps for genitals, vaginas,
don't use it.
Summer's Eve, if it says pH balance for your lady parts, like just throw that in the trash and don't use it. It's worthless crap.
I have walked the Walmart shelves over there so many times because I love that set and I've actually had some clients over in that set, which has been really fun. But every time I go over there, it is like rows and rows of like mist to your vagina, wipe this on your vagina, do this to your vagina
Stick
stinks.
this thing up in your vagina. Yeah.
Why are we telling women that their vaginas are gross?
I don't, I think it really goes back. And I think, living in the South, I know every lady that I knew when I was a small child had their bar of Dove soap in the shower. And you're like, oh, she's washing her face with that. It's so gentle. No, she used that on her vulva. because
Oh,
her mother told her, like, you should wash that with Dove soap, and, cleanliness is next to godliness.
godliness.
And I think we have this perception societally that vaginas smell like melons and roses and, perfume and whatever. They don't smell like vaginas. And so, people don't know what a vagina smells like. They don't know what it should smell like. And they think it should smell like nothing or super fragranced.
What should it not smell like?
Rotting fish, roadkill. Those are two really bad things.
Okay.
Ammonia.
Ammonia.
It happens. Yeah. From bacterial imbalance.
We dated someone that squirted like, oh my God, so much. Like every single time. Can we talk about squirting too in a minute? I have questions for
Sure.
you. I have prolapse questions too. Okay. So she would squirt and squirt and squirt for like an hour or two. Like would have like marathon sex. And then she would take a shower and just use water, which I thought was gross, but you're saying that's what you're supposed to do. But then she always kind of smelled like pee. And I was like, this cannot be normal. Is that a thing?
I mean, squirting is generally urine. It is mixed sometimes with some fluid, like from the Skene's glands. That's a lubricant. I mean, so a mucousy type fluid, but it's almost always largely urine. Yeah,
Sorry, that was
I
not very
mean,
nice in my face to do that.
it is largely urine. And so
Okay.
I would say, like, definitely as we get older, that's probably more common, and you have less pelvic floor muscle tone.
And it's
Um,
like hot right now. Like there's courses you can take on how to squirt. People think it's like guys think it's super sexy.
yeah, I
It's
mean,
been
lots of people like it.
fetishized.
Yeah. I mean, I would say it's neither normal or abnormal, but
Okay.
yeah.
So I've noticed a theme, and again, we've been with lots of women. So I've noticed a theme in the women that squirt, and there seems to be something happening inside of their vaginas where I don't know if prolapse is the right word, but like their bladders are like falling into their vaginas. Because when
Yeah.
you stick your fingers up or you put your penis in, there's stuff in there, and
Uh-huh.
it's not just like a hole. So like is that maybe part of the reason for the squirting, A, and B, like, should you be worried about that if there's things in your vagina? You're
So
like, what is this?
So that's an interesting thing also. So prolapse is super common in women that have had babies, older
Mm,
women, people have poor pelvic floor health. And so that in and of itself is pretty common. And not everyone that has a prolapse has symptoms, but oftentimes they will have some stress incontinence. And sex is a perfect example of a stress incontinence inducing situation, like
mm,
stress meaning strain on those pelvic floor muscles, not necessarily mental stress.
right.
Um, and so laughing, coughing, sneezing, jumping,
Orgasming.
running, orgasming, those can all cause
Huh.
some incontinence. And so, yes, if you're feeling a bulge inside the vagina, that's probably what we call a cystocele, which is a bladder prolapse. And so it can range in severity to, oh, there's just barely a bulge, to, oh, your bladder is hanging out of your vagina, basically. But yeah,
Should someone get that checked? Is that a bad thing?
if it bothers them. So,
Oh,
I mean, not everyone with a prolapse is super bothered by a prolapse. If it's severe, like your bladder's basically hanging out of your vagina, yeah, that's probably bothering that person a whole lot. And when you get to that point, like the treatment is surgical. You're gonna lift that bladder up and do
tuck it
some
up.
mesh, tuck it up in there. But if you are having a grade 1 or 2, where you just feel a little bulging in there, um, Kegels, yes, pelvic floor therapy, yes. Those are good things. If you're not having stress incontinence, if you're not having problems, like don't do surgery because that causes more problems for you in the long run than
Okay.
it's worth at that minimal. of symptom.
You mentioned pelvic floor. I'm just wanding around on what you've been talking about because
Sure.
this is so fucking good. What should we be doing consciously for our pelvic floors, especially as we age?
So I think, you want to maintain a good level of physical activity. You want to do core strengthening exercises, Pilates, yoga,
Mhm.
things of that nature. You want to become, want to have good physical, stamina. You don't want to be running. You probably don't want to be doing lots of aerobics
Hmm.
because those kinds of activities, your pelvic floor is like a bowl. So it kind of sits in there. It's like a bowl, suspends your, you know, uterus, you know, it's in your vagina, kind of. And well, I should say kind of. It is the musculature underneath the tissue of the vagina. Um, when you're jumping, when you're running, uh, that bowl has a lot of downward force on it
Mm.
with every single impact, and that overstretches those muscles. So whereas jumping, running, aerobics, those are great for cardiovascular health. They're shite for your pelvic floor.
Hmm.
And so,
I had no
yeah,
idea.
and so doing things like walking, swimming, biking, Pilates, yoga, those are all great, especially with Pilates because it's going to strengthen your
Hmm.
core, which communicates to your pelvic floor and your low back. And so we all have that issue, I feel like, at this age too.
Fucking love Pilates. Like my listeners have heard me talk about it. I have this little certificate. I did over 100 classes in the last 3 months.
Woo-hoo!
I've just got it. What I love is there's always this great footwork that we're
Mm-hmm.
doing on the reformer, and you can tell, like when your feet are in like pigeon in together and you're like pushing in and out on the reformer, or you're standing up doing squats with
Mm-hmm.
your toes like this. Like it
Right.
strengthens, like it zips up your legs and it zips up into
Uh-huh.
your pelvic floor, and you can fucking feel
Yes.
it. I remember I'd taken enough classes that I could actually tell I could be like tighter in my vagina
Mm-hmm.
during sex. I could like literally like pull Scott in, and I was like, what the fuck is this? Like pelvic floor strengthening actually helps your sex life.
It helps your sex life. It helps with
Helps you
your
not
genital
pee.
symptoms, helps you not pee on yourself. And it helps with prevention of UTI
Does it
because,
really?
yeah, I mean, I won't say specifically Pilates,
I'm like, I gotta go
but
take more classes
you're
now.
like, okay, let's go.
Let's go.
Um,
That and
but
my estradiol. I'm just like, woo.
yes. So anything that's going to strengthen that pelvic floor is going to help prevent like laxity of your urethra, so that you're able to empty the bladder fully, so that it's not lax and allowing lots of bacteria to climb up and ascend into the bladder. Estrogens are really great for that because if you're perimenopausal or menopausal, that tissue becomes thin, it becomes weak. Uh, Frequent UTIs are common. BV is common. Yeast is more common.
Mm.
Having estrogen in that tissue really helps with the balance and the pH and bacteria level, as well as the strength of the muscles around the urethra.
What are your thoughts on hormone replacement therapy?
You know, okay, so I have mixed thoughts on that.
Hmm.
Um, as a clinician, I've practiced for over 11 years. And during that time, I have not been perimenopausal until more recently. And things happen that could change your opinions on things, right? I feel like I feel like when I was a kid, when I was a teen, women would be going through menopause, they'd be sweating buckets, they'd be miserable, their mental capacity was fried.
They were
They
crazy.
they were
Yeah.
crazy. They never wanted to have sex.
They're
It
like,
was like,
she's
don't
going
look
through the
at me.
change.
She's going through the change. It's just the way things are. And you're like, Jesus Christ, that's what I have to look forward to. I'm having periods right now. I feel like someone's ripping my uterus out, but later it's going to be this.
Hmm.
Um, and I feel like it's very beneficial. I haven't quite joined the bandwagon of compounded HRT yet. I am much more so probably because of how I was clinically trained. Like, compounds are bad. they're not FDA approved, they're not
Yeah.
regulated, they're, you could get infections, you might not get standard dosing, you this, you that, whatever. Um, so yeah, I'm still not on that bandwagon yet. However, I will say, part of the thing with that, I feel like, is when patients go to clinics that's, you know, they specialize in HRT, um, they're doing all these blood tests on patients.
Hmm.
I mean, pointless. If you're having periods, still, we know you're not menopausal, right? So, like, we don't need to check your hormone levels. So, females make varying levels of hormones throughout their menstrual cycle.
Hmm.
Throughout the day, it fluctuates. So, if I check you today at 9 o'clock in the morning, tomorrow I might check you at 6 at night, it's going to be vastly different.
Hmm.
It's released in, varying amounts throughout the day. Um, so, in a person that's not menopausal, if you're having periods, checking your hormones is probably just costing you more money than it's worth. Because sure, like you might have had a low estrogen level yesterday, but then it might be normal today. And like 2 hours from now, you're gonna have a hot flash and you'll be like, oh, what's happening? And it's
Hmm.
the hot flashes are caused by fluctuations in hormones,
Hmm.
not the absence of estrogen. They're caused by a big fluctuation in things. So I would say testing all those hormones, especially the people that do the saliva testing, that's definitely worthless. So I would not recommend that at all. Um, but yeah, I mean, if you're a person that goes months at a time without periods, should we check your hormone levels? Yeah, like we need to know, are you having premature ovarian failure? Do you have something else that's causing you not to have a period? There are many other things that can cause that. Pregnancy being number one, and people in our age group don't even think about that. And the number of people I had in my last practice that were pregnant in their late 30s and 40s was astronomical. That was probably my highest group apart from like the teens. So it's
I'm like,
crazy.
intentional or whoopsie?
Whoopsie. A
That's a
lot of the
biggie.
time, because I would have patients that are like, oh my God, I have grandchildren. Oh my God, I can't
Hmm.
believe this. I can't. Or, wow, I haven't gotten pregnant and I've been using birth control for 10 years and holy shit, like now I'm pregnant. And they weren't unhappy
Oh,
about it, but
wow. Because of the
like,
hormone fluctuations in their 40s. Wow. My
yeah,
mother had my youngest brother at my age at
yeah.
42, and I am like my right hip hurts all the time. I cannot
Fuck
imagine
yeah, it does.
having a baby in my body.
Right?
I mean,
My
I
hip
like
hurt.
pretending to get pregnant. I don't want to get pregnant.
Your hip, your back. I mean, it's
Totally.
like all of that. You're going to be aware of some kind of brace the whole time.
Oh my God. Okay, so I had the final question I had for you, because we talked so much about women, is about men, and I had written down what's wrong with my penis. You have told me a few funny stories, so I'm curious, like when men come to see you, or when should men come to see you because something might be wrong with not you, but just, healthcare in general.
Anyone. All right.
Yeah,
No, I
anyone.
get that. You,
The collective you of
the
healthcare
collective,
workers.
sure. Um, do they have genital itching, burning, discharge, blood from their penis, testicular pain, pelvic pain that's unexplainable? Those are all reasons to go. Enlarged lymph nodes in their groin, could be a reason to go.
Hmm.
Sores that look like angry open sores, sores that are super painful that are angry open sores that don't look painful. I mean, they look painful, but they aren't. Those are syphilis usually, but whatever. And things that look like warts, go for that. So I mean, those are all reasons. If you have an unexplained fever, enlarged lymph nodes, severe fatigue, your doc
Hmm.
can't figure out what it is. Have they tested you for syphilis? Have they tested you for HIV? Like, if not, get that checked out.
Do you
So
find that women are more apt to go in for STI issues like that, or men? Because I imagine that, I mean, like if I think about my husband, he's like he has a cold and he's like, I need to go to the doctor. So like I'm curious if men are more like, what is this on my penis? And you're like, it's nothing.
it's so funny because I feel like it can go both ways.
Yeah.
Like I will have men that are like, "Oh my God, I'm so paranoid. Oh my God, I have this thing on my penis. This is dark spot. I've never noticed it before." And you're like, "Sir, that's a birthmark, or you have a vein right there. It's nothing, trust me." Or they'll have something called pearly penile papules. If you've never heard of that, look it up. Totally benign condition, very common. But they're these little bumps around the head of the penis. Very common. It's not a wart. They have them lifelong. They're just there. They don't do anything. Um, so they'll have something like that that's totally benign, and they run in to have that checked out because for whatever reason, all of a sudden one day in the shower, they're like, "Oh shit, what is that?" But then you'll have male patients that let things go for so long, and they're like, then they come in dragging their leg because they have severe pelvic pain, burning with urination, bloody ejaculate. I mean, like things of that nature. And you're just like, "Sir, what are you doing?" I mean, and then I mean, my practice is very reproductive health, sexual health focused. And so I do so much STI testing, so much STI treatment. I have a really good mix in this practice of female and male patients, or vagina or penis having patients. Um, I think in general practice, you're probably not going to see as many people with penises seeking care that identify as male, especially if they have a partner with a vagina, because they're going to say, "Oh, my girlfriend just got tested, I'm fine,"
Hmm.
that kind of deal. Um, so yeah, it goes both ways, honestly. And, like it's interesting the things that you see in public health. Uh, and sometimes, you get some surprises. You know, People ask me about herpes constantly, and the incubation window on it is crazy. So you could have symptoms as early as 24 hours post exposure with herpes, but you could never have. Or I had a patient a few weeks ago that had not had a partner in like over 20 years and had a primary outbreak. And we were like, "Oh, surely this is not herpes." And we swabbed it and it was. So,
So it can just live
um,
in your body and hang out till it wants to come play.
yeah, and
Wow.
for the most part, and people that have really good immune systems, things like herpes, are going to present fewer outbreaks. But if you're immune compromised, so
Hmm.
if you're older, if you have diabetes, if you have cancer, if you've got, an autoimmune disorder, things like that can really cause herpes to have more frequent outbreaks, or genital warts to continue to resurface even though you've been treated numerous times, because those are viral and they just hang out. So,
I have a lube question, just because we're talking
sure.
about penises. When a guy is masturbating or having sex with a woman, should he be using lube?
I mean, when he's masturbating, that's a personal preference. Some people are just, they like what they like,
Yeah,
right?
I just wondered,
Um,
like, can that do damage? Could that
I
hurt your
mean,
penis to just be like dry rubbing it?
certainly you could get some friction injury if you do things a certain way. But I would say by and large, people with the penis that have had their penis for a long time, right? They know what they can tolerate, what they can't. So, you know, they should use their body as their guide. If you're with a female partner and you have a penis, or if you have a partner with a vagina and you have a penis, like you should say, "Is this okay? Do you need to use some lube?" Just take, or don't be afraid to speak up if you're the vagina having person, and be like, "You know what? I'm really needing some lube right now." I feel like in years past, that was a thing that males who identified as male really had a thing about. Like they maybe felt some sort of ego hit, like, "Oh, this isn't doing it for you. Like, oh no, like this is horrible.
Why are
Like,
you not wet
yeah,
everywhere, dripping down your
right,
legs? Yeah.
right. But I think there's much more attention now to, you know what? Sometimes ladies just, yeah, like birth control can cause vaginal dryness. Antidepressants, vaginal dryness. Uh, Perimenopause, menopause, vaginal dryness. Everything
Irritated at
causes
your husband. Fucking vaginal dryness.
dryness. Taking antihistamine because it's spring in Arkansas, vaginal dryness. I mean, anything like that.
Perimenopause, vaginal drying. I remember waking up one day and I was like, Scott, everything is dry. Like my
Yeah.
face is dry, my vagina's dry. Like I'm so turned on
And
mentally,
you,
and I was just like a fucking dry as a bone down there.
and your hair, like the texture of your hair is different. It feels crunchy. I don't
Mhm.
know, like everything. It changes everything.
Last question. I promise I'm gonna let you go. This has been so much fun. Um, what causes, since we're still talking about penises, what causes desensitization? Like if someone has had a penis their whole life and they're like, it's been great. We've had a great relationship and it's been fantastic. But recently, I'm feeling like really desensitized.
Hmm.
Thoughts on that?
If it's a recent change, a lot of times, like, is it a new medication?
That's what I was
You
wondering.
know,
Okay.
like SSRIs, antipsychotics, those are really big culprits. Anti-anxiety meds, those are really big culprits for desensitization. Um, Frequent marijuana usage could be for some people,
Okay.
could cause some sexual dysfunction for some people. Um, Age can cause that for certain people. Do you ride a bike frequently? That could cause some
Hmm.
desensitization to the genitals. Um, you know, if it's like, I'm having a lot of decreased sensation, I'm having some erectile dysfunction, this is new-ish, but also it's kind of been coming on for a while, and I
Yeah.
don't have any of those other factors, I would say, like, oh, what is your health status overall? Because in people with a penis, things like high blood pressure,
Hmm.
things like diabetes, cardiovascular issues, those are big culprits for why a penis doesn't function the way it typically should. But just in general, age can cause changes in how your genitals function, and that goes for both.
This is so fucking depressing. So I feel like we have an estradiol to kind of like wake us back up to like rejuvenate our tissue down there so we're not having UTIs and stuff. Do men have a thing that they put on their dicks that
So,
longevity? I don't
like,
know.
longevity. So a lot of males like will do testosterone therapy
Hmm.
when, they'll have that tested. And I feel like testosterone depletion is a bit more reliable with blood testing in males than, say, doing HRT, like testing in females. It's a
Mm.
little bit different mechanism on how it's released and how it's used and things like that. Um, but in males with low testosterone, libido is lower, erections are less, fatigue is high, lower body mass. You'll see males with gynecomastia where they have a little bit, the little man boob going on.
Hmm.
And, low T levels can cause these things. So we think about menopause, but actually, there is jokingly menopause a little bit
Menopause.
too. They
Yeah.
have their own age-related changes that occur. I think that it has been real socially acceptable over the years to give men testosterone shots.
Million
For low
percent.
T,
Hmm.
there's injections, there's pills, there's patches, there's creams, there's gels, actually there's not there's not patches in the US anymore. There were, but they're not now. But yeah, there are so many different methods on the market for them. And I feel like we are now
Just now on the
steadily
board.
getting on the
Hmm.
board and having so many options available to us. But they do have their own symptoms. They get mood changes, they have all these different things that can occur that are kind of similar to what we have going on too.
We
And I
just
would
need to be
say
sweet to each
that's
other.
right. That is right. I mean, in patients with penises, there are meds that you can take for an erection that are oral. Like if you have seriously bad problems getting an erection or maintaining an erection because some health problem and you're not a good candidate for an oral med, there's actually an injection they can give into their penis now, which, ow, I mean, like, yeah.
But also, wow, if that's you.
Bless their hearts.
Fucking
Bless their
yay.
hearts. I mean, if they have the will to keep going at that
I
point.
feel like men have so many modes of empowerment that if you're listening to this and you're having erection problems and you haven't gone and sought out some of, there's so fucking much on the market. And most of
Right.
this shit you can do through telehealth. Like if
Yeah.
you're having issues maintaining an erection or whatever, like fucking go get that shit checked out and get your supplements because it is
That's right.
amazing.
So hilarious story about males with erection problems. Like, oh, a decade ago,
Hmm.
my grandpa says to me, like, my grandmother had died. It had been like a year. He started dating at like
Oh boy.
79 or 80. And he dated this little lady he went to high school with.
Oh.
And he says to me, home for Christmas, he says, "What do you do if you can't keep it up?" And I said, "Well, Grandpa, there are some oral medications that you could take for that." And he said, "Well, I've tried that and it didn't work." And I said, "Well, there are um, higher levels. It's
Hmm.
not just a one dose fits all. There are higher levels, and you can take those." And he said, "I tried the highest dose. It doesn't do that." And I said,
Okay.
"Okay. Well, there's a pump. You could try a pump," and thinking he'd be like, "Oh, I've never heard of that." He was like, "Yeah, I got one of those too, and it doesn't work." And I was like,
Dang, Grandpa's
"Oh
been doing his
God."
homework.
I know he'd been doing his homework. And
I
then
love it.
like after the fact, I just kind of was like thinking, "Oh God, I gotta get myself out of this conversation," And I said, "You know what, Grandpa, like they make an implantable pump that they could put an implant in there for you." And he was like, "I'll be damned. I'm having hernia surgery. Maybe they'll do that at the same time." So
Love
yeah,
it.
he did not end up getting that done. He actually probably had problems because of cardiovascular disease, because in the end, that is what was his cause of death. But now being 10 years older, it sort of heartens me to know that like at that age, he was still like wanting to get out there and he had those feelings. I mean,
Amen.
and I have patients occasionally that'll be like in their 80s and 70s that come in to see me and they have repeat testing because they're like, "Yeah, I have my friend that I go see," and you're like,
Oh,
"Oh, I
my
know.
grandmother, she's 101, and she told
Holy
me in
moly."
her mid 90s, I finally stopped having sex at 90. I just decided I didn't need any more boys. And I was like, okay. I've warned Scott. I'm like, let me just tell you, friend, we
Jam out
got
with
it.
your clam out, Grandma. I mean, come on.
Amber, this has been so much fun. Is there anything I should have asked that I didn't, or any wisdom that you want to leave our listeners with?
Oh gosh. I think I'll say like find a find a medical provider that's a sex positive provider. Like that is the biggest advice that I can give people because I feel like in working in public health, they patients will tell you things they would never tell. They would never tell their other medical provider. And it's not a bad thing, right? But I feel like I'm like sometimes like people's hairdresser, like
Hmm.
people just tell me all their things, and then when I say, "Okay, well, let's do this or this," they're like, "Oh, like you're not going to judge me about that?" Okay, like, and so it's empowering to you, like as a provider, to be like, "Oh, people trust me with this information." And I feel like it's really empowering to a patient because if you're not telling your provider what you do, how you are spending your sex life, you're not getting the right testing. You're
Hmm.
not getting the right testing and you're not getting the right treatment. So, and that's really not just for sex life, that's for everything. So,
Thank you for listening to the Open Bedroom Podcast. If you enjoyed today's episode, go ahead and give us a like and click subscribe below and stay up to date on all the new episodes that we release. If you have a topic that you'd really like more information on, leave us a comment below and we'll see what we can do. Feel free to share this podcast with all of your friends and especially your partners. This is a great way to open up some amazing conversations. We'll see you next week.